Hey, today I want to talk to you about how to make sure you have a good amount of vitamin D to prevent getting sick with COVID or COVID-19, and also how to supplement vitamin D if you need to safely so that you prevent any of the complications that can happen because of the vitamin D. And I'll talk to you about that later in the video. But first, in case we haven't met, I'm Angela. I am a certified health coach. I'm a registered nurse with over 20 years of experience, and I help women over 40 to get their health back. So after 40, we start to have issues that didn't show up earlier because we've been able to eat and drink whatever we want to and do and stay up late, and that starts to catch up with us. And so I help women to reverse that and get back into sometimes better shape than you even were before you hit your 40s. So vitamin D, in case you hadn't heard yet already, there have been lots of studies that show that whenever someone has a low vitamin D level, lower than normal, which is not optimal, but it's normal, it's okay, it's average. Lower than that range can put you at risk of having a worse time with COVID, more of a chance of being in the hospital, more of a chance of dying from COVID because of not having an adequate level of vitamin D. So you want to be sure to get that level checked at your annual physical. Your doctor may not be testing for the vitamin D, which is the 25-OH hydroxy. That is the vitamin D level. It's a simple test. They'll add it to your panel if you request it. And like I said, make sure that you are at least in the normal range, which is going to be over 30, more than likely. It depends on the lab that you're having your labs drawn at, but that's what normal is. Optimal is going to be around 45 to 65 is about the range that you're going to want. You'll have the best benefit of vitamin D because it helps with a lot more than immunity. It helps your overall health in so many ways I'm not going to get into in this video. But don't assume that just because maybe you took a summer vacation and you laid out on the beach all summer for a week, or that you take some vitamin D in your multivitamin, that you are fine, that you're good. I will tell you my own experience. My vitamin D level was 45, so it was on the low end of the optimal range that I was looking for, and it had dropped since several years ago. I hadn't been getting my labs checked on a regular basis. It had been a few years, but it had dropped about 10 points. Even though it is September when I had it drawn, so I had the summer, I had been outside, mostly in the morning, but definitely in the middle of the day as well. And I do take a bit of vitamin D during the week. I was taking it about maybe 3 days a week, 3 or 4 days a week, and I felt like that was a good amount to be taking. And only about 1,000 to 2,000 IUs per day. And like I said, I was just looking to maintain, and I didn't maintain doing that protocol. So now I know, and I've beefed it up. I'm definitely taking my vitamin D every day, and I'm taking more like 4,000 international units IUs per day. And so that's what I'm doing for myself. I'm just letting you know that's my own experience. So don't assume anything. Don't assume that you're fine. Just get it checked. Now, if you're taking more vitamin D, if you're taking, I would say 4,000 to 5,000 IUs or more per day, you definitely want to make sure you're taking it with some K2, a vitamin K, and magnesium. Those are the cofactors that will help to get the calcium that vitamin D is going to help your body to retain. So that's one of the things that vitamin D does, is it helps your bone health, right? But not by itself. It can't do it by itself. It just retains the calcium. And if you aren't taking the K, the vitamin K, especially the vitamin K, it is not going to be directed, that calcium is not going to be directed into the bone. It is just going to be able to calcify wherever it ends up. So it can end up calcifying your arteries. That's arterial sclerosis can happen because of the extra calcium that you are retaining. You can also have kidney stones. It can be a problem to have too much calcium that isn't being directed properly. So be sure that you take, it's real simple to find a vitamin D K supplement, and preferably in a liquid form. That's going to be the best way to make sure that you're getting it absorbed and that your calcium is being directed where it needs to go. So there you go. Vitamin D will help to prevent COVID. It will help prevent you from having a bad case of COVID, and having the calcium, having the vitamin K along with the vitamin D is going to help you to prevent any calcification happening from taking a lot of vitamin D. But do make sure that you talk to your doctor before taking any supplements. This is just information, education. Make sure that you always talk to your doctor before adding supplements. And I will see you again real soon. Bye for now.